A methodology to assess the capacity of neighborhoods to accommodate models of active aging based on sharing housing, Málaga, Spain as a study case. A paper written by Carlos Rosa Jiménez, Rubén Mora Esteban, and Sergio Reyes Corredera by the University of Málaga. Introduction: in 2050, it's estimated that the share of the world population aged 65 and over will be 16%, and 25% people living in Europe and North America could be 65 or older. Countries with aging population must take steps to adapt public programs to the growing proportion of older people, including by improving the sustainability of social security and pension system and establishing universal health and long-term care system. The problem of older people's unwanted loneliness. In many cases, living in unwanted loneliness is due to situations of economic vulnerability. Spain has a structural problem of a lack of rental housing, which is particularly acute for young people. This situation contrasts with the fact that elderly people living alone live in housing that is oversized for their needs. The creation of the neighborhood cooperative for older people to solve both problems. The neighborhood cooperative for the elderly, NCE, is a model designed to prevent forced loneliness, promote aging in place, and increase the supply of long-term rental housing. The members temporarily transfer ownership of their homes with an initial repayment period of 10 years, so that part of them are used by the members to live in groups of 3 or 4 members, freeing up the rest of the home. The aim of this research is to develop a statistical methodology to assess the predisposition of neighborhood to adopt the NCE model by means of statistical parameters. In this way, the result of this research will help public administration of social services and support for the elderly to implement new models that facilitate aging in place and to offer alternatives to the lack of rental housing. Both are models designed for people with a certain economic power, as they require significant financial investment in the case of senior co-housing, or financial investment to obtain support services, as in the case of village. To locate the most optimal areas for the implementation of NCE as a model of active aging, in the study case of Málaga, Spain, 4 steps are carried out. First, definition of features in case study. 2, definition of specific indicators to the location of the potential NCE deployment areas. 3, definition of general indicators for the location of urban areas that facilitate aging in place. And 4, assessment of indicators according bias criteria. The city of Málaga is located in southern Spain. The Bailén Miraflores district is one of the 11 districts into which the city of Málaga is administratively divided. The district has a registered population of 61,569 inhabitants, distributed among 24,388 families. The number of people with 65 or more living alone in single-person households is 3,220, the 25% of the total population over 65 years. The Bailén Miraflores district is made up of 29 neighborhoods. The study focuses on Gamarra, Hazard Campillo, Las Chapas, Los Castillejos, Los Millones, and Nueva Málaga. Definition of specific indicators for the location of potential NCE deployment areas. In age, according to the literature, we can find several population groups. Young seniors has a greater predisposition to cohabitation models such as co-housing. Elderly correspond of the sector of the population linked to the autonomous elderly and those who are retired. And older than 80 years correspond to the sector of the population with potentially greater dependency needs and where their personal autonomy decreases considerably. In order to determine the potential area of the implementation of this model, the indicator in this table has been defined. Loneliness rates, percentage of people aged 65 or plus living alone as a proportion of the population aged 65 plus in the census tract, training level, income level, housing, and housing rental. We select 2 indicators, a number and distribution of surrounding facilities In the housing selection criteria, we found the following endowment priority for the people: proximity to public transport, markets, clinics, parks, and good social services. And street slopes. According to international standards, slopes suitable for older people should not exceed 6%. For the assessment of the potential location indicator on this model, we established two levels of characterization. In principle, in this table, the three age groups are differentiated: A55, A65, and A80. The assessment of indicator according bias criteria, we differentiate between this indicator according to these tables. In the result, you can see the area with a level or high level of the indicator, in this case, in the 55 to 64-year-old people, between 65 and 79-year-old people, and more than 80-year-old people. The loneliest map shows percentage for elderly people living alone, mostly above 40%. Only one of the sectors had a lower percentage. Exceptionally, one of the sectors has a very high percentage. However, it doesn't correspond to the sector with high percentage of A80 or A65, and there is no predominance of dwelling with 3 bedrooms or more. So it may be a sector of a younger population that may small rented dwelling. Income level. The income level range is from 20,000 and 25,000 euros. Most of the neighborhood is assessed at A level. In training level, regarding the level of education of the population over 65 years of age, there are areas with high level of illiteracy or primary education. The selected area with A level have, in most cases, zero illiteracy or primary education values. In housing, the value of dwelling with 3 or more bedrooms are high and range from 64 to 96%, indicating a broad willingness of the selected neighborhood to share housing. The level A area is located in the northern sector of the study area. The neighborhood has a rental market with average price of 11 euros per square meters and average value of 976 euros. The area under analysis has the current rental market, most of which is located in the northern sector. Therefore, the constitution of a NCE would allow this market to increase. In terms of sociocultural facilities, the study area has covered the minimum values. The neighborhood is well equipped with 2 hospitals and 1 health center covering the entire study area and a wide range of pharmacies. In addition, the study area has 3 associations for the elderly. However, the proximity to the green areas with a distance of 200 meters is a problem. The study area has a slope of less than 6%, which makes it suitable setting for active aging, with the exception of the western sector with a steeper slope. The population bias, if we apply population bias, we find 2 areas for A80 rated very high and higher, 2 areas with A65 rated very high and medium, and 1 area for A55 rated medium. Unwanted loneliness bias. However, if the bias is fundamentally people living in unwanted loneliness, then the sector with potentially greater needs could be M1 and M2 that are dominated by the highest percentages of the A80 population and therefore more prone to dependency, and P1 being a mixed sector would be potentially more suitable. If the bias is toward favorably environmental conditions, then the best area for the cooperative would correspond the red sector within the area of work, which in addition to being close to social facilities, health centers, and pharmacies, is located near a large green area. The main innovation of this research is to relate the environmental characteristics of active aging in place to the areas that are potentially most valued for the implementation of a cooperative model based on home sharing intended for people living in unwanted loneliness and who don't have sufficient economic resources. The purpose of the study is to identify areas that are conducive to a potential location. It's a relatively easy system to analyze the potentiality of the existing city to propose housing sharing models based on neighborhood cooperative system beyond the housing sharing program proposed by the United States or in the networks. It's structured in the superposition of a general model that partially assesses the level of friendliness of the design space and all the most sensitive group, children, pregnant women, with a system of a specific indicator for the proposed CME model. But there are still some limitations in the result. The first one is that the result don't assess the degree of forced loneliness, as they require a significant amount of field work. Therefore, we can only estimate a certain principle of proportionality to the percentage of people living in loneliness. Future research could therefore establish a comparative framework of these results with fieldwork in order to assess the degree of reliability of the methodology provided. This article focuses on the problem of how to identify the area of the city most likely to potentially implement a cooperative model based on home sharing, a methodology based on the superposition of two systems of indicators proposed. This article shows the result project neighborhood cooperative for older people for active aging in place, implication for improving forced loneliness in big city, funded by the Consejería de Transformación Económica e Industrial, Conocimiento, Universidad de la Junta de Andalucía.